Is Dr. Rajashekhar Patil, professor practicing at the City Hospital. Now I would like to start on the relation between GERD and diabetes, management of both diabetes and GERD. So that is a GERD is nothing but a gastroesophageal reflux disease. Often it is associated with the risk factors for the diabetes and GERD are one is obesity and lifestyle changes and medication for the diabetes, including the high level sugar. It is more of a type 2 diabetes which is associated with GID. Management of diabetes mainly depends on the weight of the patient. Weight should be according to the height and control of blood sugar levels plus dietary changes like they should have a sugar-free diet with a small amount of meal and GERD management is also same like lifestyle medications, elevate the head during the sleep and the small frequent meals. Avoid lying down immediately after taking the food. The drug of choice for the GERD are medications like antacids, H2 receptor blockers, and proton pump inhibitors. Consult the doctor regarding the diabetes and the GERD management. So, type 2 diabetes and GERD have got a connections. The many studies have reported there will be a connection between the type 2 diabetes and GERD. The researchers and theories have told. And next important thing in diabetes is there will be gastroparesis, the condition where there will be stomach contents, stomach empties, delayed stomach emptying will be there, and management involves the dietary changes plus medications and plus change in the lifestyle. Medication interactions, there is a likely have medication interactions of diabetes and the GRD drugs and regular checkup of the patient, regular follow-up for the GARD and also diabetes. So management is mainly depends on the healthy weight, controlling of the blood sugar and following the diabetic diet. For GRD means addressing for the heartburns, acid reflux, dietary adjustments, elevated head during the sleep, and small frequent meals and prescription of medications according to the symptoms of the patients. Like diabetes management is mainly depends on the healthy weight according to the height and blood sugar levels. Blood sugar levels should be managed essentially by preventing the managing the diabetic complications also along with these complications will exacerbate the GERD. Dietary changes the following they should avoid the fatty diet. Diabetic diet includes the small meals, small frequent meals, and also helps in the management of the GERD, gastroesophageal reflux disease. GERD management mainly depends on the lifestyle modifications like elevation of the head while sleeping. Head should be elevated to prevent the reflux. The acid will be reflux from the stomach. The small frequent meals that will help in the treatment of GERD and avoid lying down immediately after taking the food. Wait for 2 to 3 hours after taking the food and don't lie down immediately. That will cause a GERD. For the management, as I mentioned, antacids like they will provide relief for the mild heartburn and acid reflux syndrome symptoms. And H2 receptor blockers reduce the acidic level which is present in the stomach. So this will help with the H2 receptor blockers. Otherwise, proton pump blockers also helps in the acid reflux or acid production in the stomach going to esophagus, that is the food pipe. And consultation to the doctors once the symptoms are increased in case of GERD with complications, you have to consult the doctor for the further management. The interrelation between the diabetes and GERD, there is a connection between the type 2 diabetes and GERD. The studies have shown there is a diabetes and GERD indicating there is a diabetic patients of complications like neuropathy may more susceptible for the GERD. So as a result of gastroparesis, they are likely to develop a GERD. The gastroparesis is more common in diabetes. These conditions, the delayed emptying of the stomach, where the amount of acid production in the stomach that will be reflux into the esophagus because of dietary changes and medications and speed up the stomach emptying, that will reduce the symptoms of GERD. Along with, you have to control the infection if at all it is there. Medical interaction between the GERD and the diabetes. So the drug interaction can happen interim inactive. So the indications for the taking the treatment and regular checkup for the diabetes and especially who are consuming proton pump inhibitors, they have to follow up with the doctor for the GID treatment and as well as the blood glucose level has to be controlled. This is all about the in the interaction, the relation between the GERD and type 2 diabetes. Type 2 diabetes is nothing but a long-term hyperglycemia, which will not, body will not allow enough insulin hormones to control the blood sugar level properly. That can lead to a hyperglycemia conditions, leading to serious damage over the time, especially the nerve and blood vessels will be getting involved in case of diabetes mellitus. And patients with diabetes, they will experience the digestive problems or as increase the acid reflux that will trouble the swallowing, nausea, vomiting, and heartburns, stomach pain, diarrhea, and constipations, bloating of the abdomen. These are the manifestations of the GERD as a result of in relation to type 2 diabetes. Gastroesophageal reflux disease is one of the digestive issue which will occur when there is acid in the secretion will increase in the stomach that will reflux into the esophagus, that is food pipe, and it will be irritating the protective line of epithelial damage to the esophagus. This condition damage the lower end of the esophagus, lead to long-term inflammatory changes of lower esophagus and irregular swallowing or increased esophageal malignancies or cancers are more common with the GERD symptoms. GERD is more common with the people who are having overweight, means obesity, and those who are associated with diabetes. They are more associated with GERD, diabetes. The link between the GERD and diabetes and the people with GERD can happen to be many patients are diabetic, thus including the obesity with damage to the nerve, leading to the neuropathy and hormonal imbalance like urine and motilin and obesity increases the pressure in the abdomen, which will lead to hiatus hernia. The hiatus hernia as a result of increased pressure in the intra-abdominal pressure, leading to herniation of stomach into the diaphragm or into the chest, which will lead to the esophageal muscle weakness in the lower end of the esophagus as a result of hiatus that will cause a acid reflux from the stomach to the esophagus. This is mainly diabetic and nerve damage, affect the movement of the stomach and esophagus, leading to the reflux. So this is the basic mechanism here that they develop the reflux. High blood sugar is one of the cause for gastroparesis. The gastroparesis is the condition where there will be weakness of the nerve leading to the delaying of the stomach, delayed emptying of the stomach. Or contents of the stomach will be get delayed in absorption with the as a result of gastroparesis in many ways. When the stomach is slowly due to gastroparesis, the food can stay long time in the stomach, increasing the chances of reflux esophagitis. The diabetic neuropathy is the condition where the diabetes damages the nerve and controls the important functions of your heartbeat, blood pressure, and sweating, digestion, urination, and sexual functions. When the nerve is in the stomach and the intestine are get affected as a result of diabetes, that will lead to the delayed emptying of the stomach, that is gastroparesis of the stomach, leading to bloating of the abdomen, heartburns, belching, nausea, and vomiting will be there. Specifically in patients with type 2 diabetes, high blood sugar, they are they are also known as hyperglycemia, leading to the many changes in the digestive tract as a result of increased acid production in the stomach higher level bile reflux, bile acids, lower bicarbonate levels. Additionally, the people with type 2 diabetes, esophagus will be more frequent relaxation of the lower end of the esophagus, leading to the esophageal sphincter damage will be there, lower end of the esophagus, and lowering the pressure in the lower end of the esophagus, lowering the sphincter during the high blood sugar level will cause the so lower sphincter damage causing the gastrointestinal esophageal reflux disease is more common with the type 2 diabetes.